Hello everyone, this is Chadi Alraies from Heart Trending. I'm still at the conference at Scottsdale learning all about the most recent technology and about all what we contemporary treatments for heart disease. I get a lot of questions from the patient as well as some subscribers about chest pain and what's called coronary artery disease, or the buildup in the heart, or what's called atherosclerosis. So what is all that? This is a heart condition that is usually affect the lumen of the arteries that supply blood to the heart. So think of it this way. The heart is a pump that has to work and beat more than 80,000 times every day. And for this pump to pump, it has to have arteries that supply blood to the heart that can supply blood to the pump. And these arteries sometimes get clogged because of high cholesterol, smoking, diabetes. And I have a dedicated lecture about the risk factor for heart disease. But here I'm trying to focus on the symptoms. So the more narrowing you have in that lumen, the more blockage you have in that lumen, it's getting narrower and smaller and smaller, similarly to that like old house pipes or when you are kind of pinching the garden hose. This is something patients start to have shortness of breath, and most commonly, especially in men, have what's called chest pain or chest pressure. Oh doc, I feel like there's tightness on the chest. This is something we should keep an eye on, and definitely has to seek medical attention to. Chest pain can be different reasons, can be a heartburn, can be GERD or what's called GERD, or can be called muscle and bone joint. But again, if it is in this area, especially in women, has some indigestion or nausea, especially if you have risk factors like diabetes, hypertension, this has to seek medical attention and also a cardiologist to be evaluated for this chest pain. So what is atherosclerosis or what is coronary artery disease? Risk factor, as I mentioned earlier, is diabetes, high blood pressure, cholesterol, family history, as well as smoking. And genetically, meaning this is considered one of the most risk factor. When I say family history of heart disease, this is kind of premature heart disease that happened at age 40s for men or in less than age of 60 in women. This is something you have familial, meaning there is a predisposition in genetics for heart disease. You are at risk factor for that, and you have to be aggressively managing risk factor by watching the cholesterol, watching diabetes being controlled very well, as well as the smoking. What are the presentation? Presentation, as I mentioned earlier, is chest pressure, tightness in the chest, and sometimes nausea and indigestion in women. Oh doc, I don't feel well and I have to take Pepsid or I take a cola or something to digest very well, especially in women. You have to keep, this is something equivalent to what's called angina or chest pain. So what do we do usually? Usually a patient, if they are stable, we come to the clinic and we do an EKG, which is a 12-lead EKG with the stickers on the chest, and we'll see if there's any abnormalities there. But if there's everything reassuring, we send the patient to what's called a stress test. And stress test, this can be two types. One type is you come on a treadmill and you walk on a treadmill, and there is a heart monitor continuously watching the heart rate and it's going up. There is an inclination as well as a speed in the treadmill that goes a little bit faster and also steeper to push your heart to go to what's called target heart rate, which is between 140 to 170 beats per minute. Once we reach that, there is always a component of imaging into it. Either we do an ultrasound of the heart to see if the heart squeezing in sync together, or there's what's called nuclear stress test, where we have an injection with the medication attached to the heart, and then we take a picture of the heart before and after exercise. If there is any defect in this, if there is a two picture before and after are matching each other, there's no problem, then everything's good. But if there is mismatch, or if there is an area of the heart not getting enough blood supply, then there's an area to show that on the stress test, and there will be a defect, we call it, on the stress test. So what we do next? Usually we recommend, if somebody's still having symptoms with the stress test, we recommend them to do what's called an angiogram. This is where we bring the patient to the cath lab, we do angiogram to the wrist or groin. I'll talk to you about this in a separate video. And then we go up with the catheter, inject contrast, and find a blockage, and then go fix it with the balloon stent. But first of all, before we go all through this, usually we prescribe medication to the patient that include aspirin. Also we include some medication called nitroglycerin, and also medication called beta blocker to slow the heart, make it relax, and also get enough blood supply. So in summary, this is the symptoms you should be careful and aware of, which is a chest pain and shortness of breath and indigestion. So be careful with these symptoms and seek your medical attention and talk to your primary care. I hope you like this video. Please like this video and hit subscribe button, and see you in the next one.